Hi, I'm Charlie. I've had a triple bypass. This is my story. My life before I had my heart event was pretty much normal. Well, pretty much normal for a middle-aged Maori person who was slightly overweight. Part of my occupation, my job requires that I have to be reasonably fit. Reasonably fit means that every 2 years I have to do a physical fitness test. It was while I was completing one of these tests that halfway through the test, I couldn't breathe. A test that I'd done many times before. And it came as a huge shock when I failed quite dismally the following month after, well, I didn't run myself into the ground, but I certainly applied a lot more physical effort to my training. Went back exactly 1 month later. I was doing the test. I would have passed if I'd have kept going. Same thing happened again. That was a pretty dangerous period for me between my first failure and the second attempt. I went back to the GP and he says, well, we can't totally exclude coronary heart disease. And that to me, even I laugh now because I have a family history of coronary heart disease. Why I laugh, it shocked me actually that it was affecting me in that way. Well, that's what he suspected because my father, bless his cotton socks, passed away at 52 as a result of a heart attack. And my mother, she lived to the mid-70s and she passed away. Similar symptoms, but there were other aging factors to take into consideration. My eldest brother, who is half my size, last year had a heart event similar to the one that I had, the 23rd of January. I was prepped for surgery, day surgery. They wheeled me off into the theatre. I was still awake. I was aware what was happening. The angiogram went okay, but once the angiogram was completed, the cardiologist says, we won't be continuing the next procedure, and I'll talk to you about that in the recovery room. In the recovery room, I was told that the angioplasty is, which I found out is when a stent or stents are inserted into your bloodstream and into your veins, and I couldn't have that procedure done because one of my arteries was completely blocked and the others, there's a couple that weren't too far away from being the same. And that just floored me. I was gobsmacked. Thankfully, the cardiologist, he says, but wait, operating out of that hospital is a world-renowned heart surgeon. And he's going to come and talk to you about a procedure in the next half an hour once he's finished surgery. What happened was the cardiologist reassured me. He says, no, you're not likely to have a heart attack simply because we are going to give you some pills and some drugs to control that until you have the surgery. I was up and down. I was up and down emotionally. I did things like, I prepared myself to die. I did. I prepared myself to die. I made sure my will was up to date. I made sure anything outstanding was taken care of for my wife. And one particular moment, a week before the actual surgery, we had a family meeting, an excuse to get on the piss, to be quite honest, and have a good meal. We were basically saying our goodbyes and just bringing everybody up to date with what we were doing and what we intended to do for the next year or so. We have these meetings annually, and I, in the presence of my brothers and sisters, the occasion really got to me because I just burst into tears. Absolutely cried like a baby. I did say it at the time. In circumstances like that, where I was convinced I was going to die, don't leave anything that you think that you need to say. Leave no stone unturned, leave no thought unexpressed, and leave no words unsaid, particularly when it comes to your loved ones. And that's what I did. That was a week before. On Sunday the 5th of March, Ed and I duly arrived at Braemar Hospital on Sunday evening. I spent the night there. Monday morning, I woke up, well, I didn't actually get much sleep. I was prepared for the operation, and that, as far as I can remember, being wheeled into the theatre, I remember thinking, it's all white. Then that was about it. And the next sensation I had was being woken up with Anne staring at me, and all these wire things hanging out of me. There was heaps of wires attached to me. I was in the intensive care unit, or the recovery suite. The second day, the staff there noticed that there was a decline in my recovery for whatever reason, and they were quite concerned to the extent that I was sent across the road to Waikato, loaded into an ambulance, and this bumpy ride across the road, up the hill, and being wheeled into this white room. And in this white room was a person dressed in a white dust coat, and I went, oh God, I've died. And I must have said it out loud, because Anne says, no you haven't, I can see him too. And I went, oh, okay. Anyway, he was the neurologist, and he talked to me for a little bit there about various things. He asked me about the surgery, what I'd done prior to the surgery and all that sort of stuff, and I told him how I'd got, he says, you've got your will in order, you've got all your affairs, and I said, yes. And he says, I think I know what's wrong with you and why you're not recovering. Did you have a plan for success? And I says, well, what do you mean? You've survived the surgery, which you probably thought was going to kill you. I says, yes. So did you have a plan for survival? And I sort of went, oh, no, I didn't. He says, well, that's what's wrong with you. What you need to do, young man, and he was younger than me, is plan for survival, because you've survived. And that was it. And that's all it took. The recovery process was slow. I mean, that's what I found frustrating. I was really annoyed with myself. I couldn't do things which I thought I should be able to do. But equally, when you do have your good days, you forget about the bad. I'm having to think really hard now, because it's a long time, about the actually getting out of bed, because that really was a major for about 2 weeks. And actually sleeping. Now, I'm pretty big. Trying to sleep with my arms like this is bloody impossible. It's bloody impossible. So I utilised the piece of my equipment that I normally have to wear to go to bed, namely my stab-proof vest. I took the pads out, and it was perfect, because I was able to strap my chest really tight, and I could lie on my side and get a decent night's sleep. My support network in the early stages of my recovery were my wife, and my wife. I have slowly made some lifestyle changes. The eating, mainly. I enjoy eating. You don't necessarily have to have meat for every meal. In fact, you can go without that for at least one meal a week. That's what we've started at. We're actually up to about two now. I used to exercise previously, sort of slap happy exercise. I've got myself I've started an exercise regime since I've been cleared to do exercises involving chest movement, without fear of upsetting that. Listen to your body. Your body will tell you. Mine was trying to tell me something. It took me a while to finally twig what it was telling me. And thankfully, I listened just in time.